Hi, my name is Jen. I'll be your nurse today. May I have your first and last name and date of birth?
Phoebe Sutton, September 9th, 1956.
Okay, and how would you like to be addressed?
Phoebe.
Phoebe? Okay, Phoebe, what is your gender identity?
Female.
Female, and your sex assigned at birth?
Female.
Okay, I have a couple other questions for you. Can you tell me where you are today?
The Med Center Women's Clinic.
Okay, and then what's the date today?
May 30th,
Okay.
2022.
Okay, and who's the president?
Joe Biden.
Awesome, fantastic. Alrighty, so what brings you in today?
Well, I turned 65 last September, so I'm kind of just checking on all my stuff. But probably what prompted it, I just had kind of lower back pain more so in the last year.
Okay.
Kind of had it off and on all my life as I garden and overdo it, clean, you know.
Okay.
But that I just want to know that there isn't a bulging disc, or all my friends now got arthritis, or they're all, that's everyone's talking about my hip, blah, blah, blah. So I just want to know there's nothing really wrong, that posture and physical therapy maybe or something, better behavior would make it better. I'm probably at 65 is not going away, but better.
Okay, so when did that back pain start bothering you?
Well, like I said, I've kind of had it off and on in my life, but that's probably everyone does, but probably more than last year.
Okay.
And through the winter, you know, just, yeah.
Right, okay, so it's in your lower back. Is it right in the middle, or where?
It's more like right here.
Okay.
Wherever these, are those your, I don't know.
Okay.
Anyway, and kind of in the morning when I get up, stiffer and that kind of thing, so.
Okay, does it go to one side? Does it affect your hips, or down your legs, or up your back?
Not really, except that I think I read a lot, and so I lean into the light, and I shouldn't, and my chair does too big for me because I'm little, and so a little more on the right.
Okay.
It did go into my hip this last winter, and I went to a chiropractor, and he said it's not your hip, it's your lower back, and he just gave me a little procedure that knocked it out, and so I was like, that's great.
Great, yeah.
And it's not my hip because everyone's complaining about needing a hip replacement, so. Hopefully it's not that.
That is good. Yeah. Okay. And so you said it's worse in the morning. Is
Probably when you lay all night.
Yeah.
You know.
Okay.
Yeah.
Okay. Anything that you found that helps the pain?
Probably behaving better and not bending over wrong and overdoing it and stuff.
Okay.
I should walk more, but I'm a reluctant walker, so.
Okay. So getting up and walking around does help.
Yeah.
Okay.
Moving through your day, yeah, by an hour. Most of the time, you know, it kind of comes and goes in a period of 4 days or something. So I tend to sit Indian style, probably not good.
Yeah.
Things like that.
Okay. Do you take anything for the pain?
If it's bad enough, I'll take ibuprofen, like at night.
Right.
I don't know why. Somehow it seems like back in the old days we took aspirin all the time, and now they're saying, you know, not all the time. So I try to hold back. But anyway, if it's bad enough, I'll take a couple ibuprofen.
Okay. And severity. So on a scale of 1 to 10, when the pain is the worst, what would you say it rates at?
Most of the time, about 4.
Okay.
I think when I went to the chiropractor, it was about 7.
Okay. So I have some other questions for you. Do you have any allergies?
Codeine makes me nauseated.
Okay. What medications are you currently taking?
I take levothyroxine, 75 micrograms.
Okay.
For low thyroid.
Okay. Any herbal supplements or over-the-counter medications?
I take melatonin at night to help for sleep.
Okay.
I got my marijuana license last September.
Okay.
To also help me with, I've kind of had anxiety all my life, and probably more so in the last year too. And so I just got that, and I typically just use it when I go to bed at night. In the daytime, if I've had a lot of anxiety, I might take a little bit, but I try to avoid that.
Okay. So just to recap, you take levothyroxine, 75 micrograms. You take melatonin. What strength is the melatonin?
5 milligrams. I used to take 10, and then I read you're not supposed to, probably don't even need but 2, but I think this, anyway, 5 milligrams.
Okay, so 5 milligrams. And then you take marijuana gummy at night, and then throughout the day as needed?
Some in the day.
Okay. And
some days not at all, but yeah.
Okay, and occasionally ibuprofen for back pain. Already. Any other medications I'm missing? No? Okay. Do you have any diagnoses? So you take levothyroxine.
Thyroid.
So, okay.
I'd say thyroid and anxiety.
Okay, so 2 diagnoses, or thyroid and anxiety.
And just an aside, I have worked with my doctor and she's tried to get me to take like Xanax and some different things. Well, one doctor did. And it's like, I really don't, I want to try to not do that. So that's what I'm trying to do with the gummy and.
Yeah.
Yeah.
Okay. Now, your family's medical history. Are there any chronic conditions or genetic conditions?
Both my parents drank too much. My mother was clearly an alcoholic.
Okay.
And my dad just could have been a codependent drinker with her. My dad's side of the family had heart disease. He had a bypass. Probably lived 10 years past that. Mother's side, really nothing except she drank too much and they both smoked.
Mm-hmm.
And up till they both died of a 4-month illness, mom lung cancer, dad had a neck cracked and it went wrong, and it just at 78 smoking and drinking, it didn't end up well after 4 months. But up to that time, they never even take a prescription medication.
Wow, that is
aspirin
amazing.
for sore and headache.
Right.
That's it. Yeah.
Wow.
So, yeah.
Okay.
Yeah.
So some heart disease and cancer.
Now, yeah, my mom died of lung cancer, but I wouldn't say that's genetic. It's probably the smoking.
Yeah.
I'm not a doctor, so.
Yeah. Right. Okay. Past surgical history. Have you had any surgeries?
I was born with a cleft lip, so I had all that repair, and I had 2 C-sections with my babies.
Okay. Okay.
That's it.
Alrighty. Any recent hospitalizations?
No.
No? Okay. Do you smoke cigarettes?
Yeah.
You do smoke cigarettes. Okay.
I smoked pretty much since I was 26.
Okay. And then about how much do you smoke a day?
Probably a pack.
Alright. Do you drink alcohol?
In the past, I've drank way too much alcohol. Through COVID, there was some day drinking, and I lived at the lake, and I just really, probably around the time I got the marijuana card, I just started slowing down. I wouldn't drink at social occasions because everyone's drinking too much anyway.
Right.
And then more recently, I just said, I'm no more booze. I'm done.
Okay.
So.
Okay.
Yeah.
Any recreational drug use?
Never.
No. Okay. And then, do you feel safe at home? Do you have a good support system in place? And suicidal thoughts?
No, I got a great relationship with my kids and my siblings, my husband, and husband. You know, we all have stuff with our husband.
Right.
But my siblings and my kids are.
Okay. Okay.
Yeah.
Alrighty. Fantastic. Well, that's it for the questions. Are you okay if I go ahead and do the physical exam?
Yes.
Okay.
Yes.
Alrighty.